Hello, this is Basil Hariri,
And I'm Mia Neidhardt.
and we are with the King County Auditor's Office presenting our audit, Jail Health, Behavioral Health Medications Reach Many, but Gaps Remain for Some. Before diving into our findings, I'd like to provide some context and an acknowledgement of the work Jail Health Services does. First, Jail Health employs psychiatric providers, meaning physicians and nurse practitioners who prescribe medications, but also psychiatric evaluation specialists, nurses, and a social services team to provide behavioral health medication and services at the downtown jail. This is an especially complicated operation because the jail is a secure environment. Jail health staff work closely with and depend on DAJD to provide healthcare to patients. This requires extensive communication and coordination, which can complicate otherwise simple healthcare interactions. For example, if there are no correctional officers available to escort a patient to their next appointment, jail health providers have to adapt as best they can. Next, patients at the jail have higher rates of behavioral health need than the population as a whole. Shortages in behavioral health care in the community mean that many of jail health's patients don't have access to behavioral health care outside of the jail. This means that jail health provides many patients with care they do not receive anywhere else. Jail health prioritizes stabilizing people who come into the jail with higher behavioral health needs. This is a reasonable approach, but can leave some gaps for patients with lower or less visible needs. Despite these complications, jail health provides behavioral health services to thousands of patients every year. Jail health ordered behavioral health medications for over 2,500 patients at the downtown jail in 2023. This audit focuses on those medications, including psychiatric and substance use disorder medications. Jail health services staff do provide other behavioral health services to patients like assessments and education, but those were outside of the scope of this audit. We also wanted to note that many people we interviewed had positive things to say about jail health's behavioral health care. Patients said that it's really helpful for their mental health when they're able to get new medications. Experts we worked with to review jail health's policies were impressed with the thoughtful consideration put into them. And community organizations told us jail health's practices have improved in recent years, especially around increased access to substance use disorder medications. The findings and recommendations we describe next will help ensure improved medication access and transparency and build on the work jail health is already doing. Here are the key takeaways of the audit. We found that wait times for clinic appointments with psychiatric providers, which can be key to getting or restarting medication, can be long. Many of these appointments are not completed before a patient is released. Second, jail health staff members, community advocates, and patients said that some of the medication changes or discontinuations jail health makes according to its prescribing guidelines can result in negative side effects. There are also opportunities for improved communication with patients about these changes. Lastly, jail health provided a supply of behavioral health medication at release to approximately 20% of people with a prescription for those medications in the jail in 2023. Jail health is considering efforts to increase the supply in the future, but there are opportunities to reduce barriers for patients now. The first area we looked at was how long it took for patients to get their first behavioral health medication after booking. And we found that wait times for psychiatric clinic appointments may be a barrier for some patients. We analyzed jail health data from 2023 and found jail health ordered most behavioral health medications within 2 days of a patient's booking. And most patients received their medication within 24 hours of the order being placed. However, we also found that some medications were ordered more than a month after booking. Many factors can affect when jail health places a medication order, but some patients can't have their medications ordered until they've been seen at a psychiatric clinic appointment. Psychiatric clinic appointments are where providers meet with patients, assess their behavioral health needs, and prescribe or adjust medications as needed. Psychiatric clinic appointments are specifically for patients with lower behavioral health needs who stay in general population housing, as opposed to more intensive psychiatric housing. Jail Health aims to see patients in psychiatric clinic appointments within 30 days of the appointment being ordered, but has struggled to meet that goal. Something worth noting is that most patients are released within 30 days of booking. With that in mind, let's take a deeper dive into these wait times. This graphic shows the end result of patients' first psychiatric clinic appointment ordered in 2023. In the blue slice, you can see that 60% of these orders were not completed before the patient was released. These are situations where the patient stayed at and left the jail without seeing a psychiatric provider for their needs. In the orange slice, you can see that 22% of appointments were completed. Of these completed appointments, about 34% of them were completed within Jail Health's 30-day goal. Most were completed within 60 days. Again, there are multiple reasons for these results, including that stays in the jail are frequently very short. However, clinic appointments are a necessary step for some general population patients to be assessed and have medications restarted or prescribed for the first time. Patients, nurses, advocates, and others noted that wait times for appointments were leading to worsening symptoms and behavioral challenges. Jail Health has taken some steps to reduce wait times, but it doesn't have a formal understanding of its psychiatric care capacity or need. Jail Health's monitoring of psychiatric clinic wait times is ad hoc and irregular. Given the multiple potential reasons for unfulfilled appointments and long wait times, Jail Health will need to develop additional strategies to reduce wait times suited to its context. With that in mind, we made recommendations to assess current resourcing and determine if there are better ways to meet patients' psychiatric needs. More specifically, we recommend that Jail Health Services develop, document, and implement a plan to reduce psychiatric clinic wait times for patients in the general population at the downtown jail. This plan should include updates to their behavioral health staffing plan, a review and update of current standards for psychiatric clinic appointment wait times, and a process to track wait times against the standard for patients with both more and less severe needs. And with that, I will hand it off to Mia to talk about medication changes.
Great. So I'm going to talk a bit more about our findings about medication changes. Now, based on their prescribing guidelines, jail health providers sometimes change or discontinue patients' existing medications that had been prescribed by a psychiatric provider in the community before a patient was booked in the jail. And jail health can make these changes without first consulting the patient or the original prescriber. Now, people we interviewed for this audit, including nurses, community advocates, and patients, told us that some of these changes can result in negative side effects. And just as we noted with delays, they can lead to negative health or behavioral issues. Some patients also said that they did not always receive notice about these changes beforehand, and communication is not accessible for all patients, for example, those that have difficulty reading. So we recommend that jail health more frequently review and update their prescribing policy guidelines, incorporate a risk assessment, and incorporate perspectives from nurses, patients, and community advocates. And we also recommend that jail health update its procedures to more efficiently and effectively communicate medication changes to patients. Our last area of findings are about medications that are provided to patients at the time of their release from jail. The purpose of this is to provide a supply that the patient can take until they're able to connect with a community provider to get a new prescription or refill. And this is important because having a supply of medication can help prevent worsening symptoms of a patient's underlying conditions in the meantime, and prevent withdrawal, overdose through self-medication, and even death. In general, jail health's policy is to provide a 7-day supply of a patient's medications at release when appropriate. But given current wait times to see a community provider, this amount is not always sufficient. Also, in 2023, we found that fewer than 20% of all patients who were prescribed behavioral health medications received a supply at release. This might be partially because aside from programs that focus on patients in some priority groups, such as those taking medications for substance use disorder, Getting medications at release is generally up to the discretion of a provider or nurse, or based on a proactive request from the patient. And multiple patients that we interviewed were not aware that they could request medications at release, but said that they would have done so if they had understood this option. So we recommend that Jail Health implement formal strategies to expand patient access to medications at release, including improving communication and developing more pathways that don't rely on patients to have to proactively advocate for themselves. Now, Jail Health already has efforts underway to provide medications at release to more patients, which could be a great starting point to implementing our recommendations. So just to recap what we've been sharing with you, Jail Health prioritizes stabilizing people who come into the jail with higher behavioral health needs. And this is a reasonable approach, but it does leave some gaps, such as long wait times for clinic appointments. Also, medication changes or discontinuations can result in negative side effects, and there are opportunities for improved communication with patients. And finally, Jail Health does not currently provide a supply of medication at release to most patients. We'd like to thank Jail Health and DAJD for their participation in this audit, and a full copy of our report is available on our website. Thank you.